How to get rid of a fever. 1. First, wait it out. If you do have a fever, remember this: fever itself is not an illness, it's a symptom of one. So, in essence, your body's natural defenses can actually shorten an illness with its quick response and increase the power of antibiotics. These natural processes should be weighed against the discomfort involved in not medicating a slight fever and letting it run its course, says Dr. Rosenberg. 2. Hydrate, hydrate, hydrate. When you're hot, your body sweats to cool you down. But if you lose too much water, as you might with a high fever, your body turns off its sweat ducts to prevent further water loss, making it more difficult for you to cope with your fever. The moral of this story: drink up. In addition to plain water, experts favor the following. Watered down juice, straight juice, no matter how nutritious, is too concentrated to drink in any quantity when you have a fever and may cause diarrhea. Always dilute 100% fruit or vegetable juice with 1 part juice to 1 part water to make it easier for your body to absorb. Linden tea: although any tea will provide needed fluid, several are particularly suited for fever, says Gail Molesky, MS, Rhode. One combination she likes is thyme antibacterial, linden flowers promotes sweating, and chamomile flowers reduces inflammation. Steep 1 teaspoon of the mixture in 1 cup of freshly boiled water for 5 minutes. Strain and drink warm several times a day. Linden tea by itself is also good, she says, and can induce sweating to break a fever. Use 1 tablespoon of the flowers in 1 cup of freshly boiled water for 5 minutes. Strain and drink hot often. Willow bark tea: this bark is rich in salicylates, aspirin-related compounds, and is considered nature's fever medication, Molesky says. Brew into a tea and drink in small doses. 3. Opt for ice. If you're too nauseated to drink, you can suck on ice. For variety, freeze diluted fruit juice in an ice cube tray. 4. Cool down with wet compresses. Wet compresses help reduce your body's temperature output. Ironically, hot, moist compresses can do the job as well. If you start to feel uncomfortably hot, remove those compresses and apply cool ones to the forehead, wrists, and calves. Keep the rest of the body covered. If the fever rises above 103 degrees Fahrenheit, don't use hot compresses at all. Instead, apply cool ones to prevent the fever from getting any higher. Change them as they warm to body temperature and continue until the fever drops. 5. Or trying sponging off instead. Evaporation also has a cooling effect on body temperature. Try dabbing cool tap water onto the skin to help dissipate excess heat, says Mary Ann Payne, RN, a nurse clinician in Philadelphia. Although you can sponge the whole body, she says, pay particular attention to spots where heat is generally greatest, such as the armpits and groin area. Wring out a sponge and wipe one section at a time, keeping the rest of the body covered. Body heat will evaporate the moisture and cool the skin. 6. Pop an OTC pain reliever. If you're very uncomfortable, take an over-the-counter pain reliever. For adults, aspirin, acetaminophen, or ibuprofen can be taken according to package directions. The advantage of acetaminophen and ibuprofen over aspirin is that fewer people experience side effects. So which one should you take? All are effective, but some work better for particular ailments. For example, aspirin and ibuprofen are common nonsteroidal anti-inflammatory drugs (NSAIDs), so they're effective at reducing muscle pain and inflammation. Acetaminophen is recommended if you have gastrointestinal sensitivity or are allergic to aspirin. It doesn't work as well as NSAIDs for inflammation and muscle aches, however, it's a safer drug to use and has minimal side effects, as long as it's taken in the proper dosage. 7. Dress the part. Use common sense as far as clothing and blankets go, says Payne. If you're very hot, take off extra covers and clothes so that body heat can dissipate into the air. But if you have a chill, bundle up until you're just comfortable. 8. Take your time with eating. Don't fret over whether you should feed a fever or starve one, just drown it. Most people don't want to eat when they have a fever, so the important thing is fluids, Molesky says. Once your appetite starts to return, eat what appeals to you. Toast, scrambled eggs, chicken soup, and vanilla pudding all go down easy as part of your recuperation. For more inspiration, here are the best foods to eat when you are sick. When should you see a doctor about your fever? Temperatures of 102 degrees Fahrenheit or higher may be serious, particularly if you are also feeling sick with other symptoms. Adults with chronic illnesses, such as heart or respiratory disease, may not be able to tolerate prolonged high fevers. See your doctor if you experience one or more of the following, per our experts and the Centers for